Stroke, cerebrovascular accident, is one of the leading causes of death and disability among older adults in the U.S. This condition often strikes suddenly, leaving devastating consequences not only for the patient but also deeply affecting families and society. According to medical statistics, the stroke rate among the elderly is steadily rising due to chronic conditions such as hypertension, diabetes, dyslipidemia, and unhealthy lifestyles. However, the good news is that most stroke cases can be prevented if older individuals are equipped with the right knowledge and implement simple yet effective daily measures. This video will present some practical tips to help seniors reduce their stroke risk, contributing to improved quality of life and longevity. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the elderly tips. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment below this video to let me know, so I can make better video for you. 1. Blood pressure control. Hypertension is the leading risk factor for stroke, especially among older adults. When high blood pressure persists, it damages blood vessel walls, increasing the risk of clot formation or vessel rupture in the brain, leading to ischemic or hemorrhagic stroke. Therefore, maintaining stable blood pressure is the most important preventive measure against stroke. First, seniors should measure blood pressure regularly, at least once or twice a week or as directed by a physician. Regular monitoring helps detect anomalies early for timely intervention. Those with a history of hypertension should continue taking medication as prescribed and must not stop even if blood pressure appears stable. Besides medication, lifestyle adjustments are equally important. Limit sodium intake to less than 5 g per day. Avoid overly salty foods such as dried fish, pickles, fish sauce, or instant noodles. Increase intake of vegetables, fruits, nuts, and fish to naturally lower blood pressure. Maintain a healthy weight and do gentle physical activities daily, such as walking, slow cycling, or Tai Chi to support stable blood pressure. Additionally, avoid prolonged stress, get enough sleep, and reduce consumption of alcohol and coffee. With a combination of medical monitoring and lifestyle changes, older adults can effectively control blood pressure and significantly lower the risk of stroke and dangerous cardiovascular complications. 2. Managing underlying conditions, diabetes, heart disease. In older adults, underlying conditions such as diabetes, heart disease, and dyslipidemia are major risk factors for stroke if not well controlled. These illnesses damage the vascular system, causing narrowing or blockage of cerebral arteries and increasing the likelihood of clot formation or brain hemorrhage. For diabetics, maintaining stable blood glucose is crucial. Sudden high or low blood sugar can severely impact the nervous and cardiovascular systems. Patients should monitor blood sugar regularly, follow a proper diet, reducing refined carbs and increasing fiber, take medications as prescribed, and exercise regularly. Heart disease, especially arrhythmias like atrial fibrillation, can cause blood pooling in the heart, leading to clot formation and stroke if a clot travels to the brain. Therefore, individuals with a history of heart conditions should have periodic checkups. Take rhythm-regulating and anticoagulant medications if prescribed. Also, elderly people often have dyslipidemia, which causes plaque buildup in blood vessels. This narrows arteries, reducing cerebral blood flow. Hence, controlling cholesterol via diet low in animal fat, rich in healthy fats from fish, olive oil, and taking lipid-lowering medication when necessary is essential. In summary, effectively managing chronic conditions is key to reducing stroke risk and improving long-term quality of life for seniors. 3. Healthy eating habits. Diet plays a crucial role in stroke prevention, especially for older adults. A healthy diet not only helps control blood pressure, blood sugar, and lipid levels, but also enhances overall health and longevity. Seniors should prioritize heart-friendly foods like green vegetables, fresh fruits, whole grains, fatty fish, salmon, mackerel, sardines, nuts, and vegetable oils, olive oil, canola oil. These foods are rich in fiber, antioxidants, and omega-3 fatty acids, helping reduce inflammation and improve blood circulation. Limit harmful foods such as animal fat, offal, processed red meats, sausage, smoked meats, fried foods, sugary sodas, sweets, and overly salty dishes. These can raise blood pressure, increase blood lipids, and promote atherosclerosis, primary cause of stroke. Older adults should also reduce daily salt intake to a maximum of 5 g per day, about 1 teaspoon. Limit fish sauce, MSG, soy sauce, and cook with less salt. Additionally, drink enough water, 1.5 to 2 wells/day. Depending on health, and limit alcohol, coffee, and strong tea, important components of a healthy diet. A balanced, nutritious diet not only helps prevent stroke, but also keeps seniors feeling light and energetic in daily life. 4. Regular physical activity. Regular physical activity is a simple yet effective means of preventing stroke in older adults. Exercise helps regulate blood pressure, lipids, and blood sugar, while also enhancing brain blood flow, improving cardiovascular endurance, and keeping the mind sharp and refreshed. Seniors should maintain light exercise daily for 30 to 60 minutes, depending on their health and fitness. Suitable activities include walking, slow cycling, tai chi, gentle swimming, or yoga for older adults. These exercises build strength and are gentle on joints and the heart. It is important to be consistent rather than doing intense workouts irregularly. Beginners may start with 10 to 15 minutes per session and gradually increase. Exercising early in the morning or late afternoon allows for fresh air and relaxed mind, reducing stress, a factor that can increase stroke risk. In addition, seniors should avoid prolonged sitting or lying still. Even indoors, regular movement such as walking, gardening, or light stretching promotes healthy circulation. Regular activity not only prevents stroke but also enhances life quality, helping older adults live with joy, health, and purpose. 5. Quit smoking, limit alcohol. Tobacco and alcohol are two dangerous contributors that increase stroke risk in older adults. Frequent use of these substances damages cardiovascular health and harms cerebral vessels, increasing the likelihood of a cerebrovascular accident, especially in people with pre-existing conditions like hypertension, diabetes, or dyslipidemia. Cigarettes contain thousands of harmful chemicals, including nicotine and carbon monoxide, which constrict blood vessels, raise blood pressure, and reduce oxygen delivery to the brain. Smoking, even secondhand, heightens clot formation and atherosclerosis, the two main stroke risk factors. Therefore, seniors should quit smoking completely and avoid exposure to secondhand smoke. Excessive alcohol increases blood pressure, disrupts heart rhythm, and raises the risk of cerebral bleeding. Heavy drinking also impairs liver and brain function and increases fall risk, a secondary cause of stroke from head injury. Therefore, it's best to avoid alcohol entirely or consume only very modest amounts under medical advice. Quitting smoking and limiting alcohol significantly reduces stroke risk, enhances respiratory function, boosts immunity, and helps seniors live healthier, more alert lives. 6. Manage stress, get enough sleep. Mental health and sleep quality significantly affect stroke risk, particularly in older adults. Chronic stress, anxiety, depression, or poor sleep can raise blood pressure, disrupt heart rhythm, and damage cerebral vessels, factors contributing to stroke. The elderly often face life changes such as retirement, loss of loved ones, loneliness, or illness, which may lead to stress. To reduce mental burden, seniors should engage in healthy activities such as tai chi, meditation, reading, gardening, listening to gentle music, or socializing with friends and family. Maintaining a positive, cheerful mindset promotes beneficial hormone release that supports heart and nervous system health. Quality sleep is also indispensable. Seniors should get 6 to 8 hours of sleep per night, avoid late nights or shallow sleep. Before bedtime, avoid heavy meals, phones, coffee, or strong tea. Create a calm, cool, softly lit sleeping environment, and maintain a consistent sleep schedule. Managing stress and getting enough rest not only refresh the mind but also stabilize blood pressure, enhance brain circulation, and serve as a soft shield against stroke prevention. 7. Regular health checkups. Periodic health screenings are among the most effective ways for seniors to detect stroke risk factors early and take timely preventive or therapeutic action. Many elders may have conditions such as hypertension, diabetes, dyslipidemia, or atrial fibrillation without obvious symptoms. If left untreated, these conditions may silently progress and suddenly lead to stroke. Older adults should undergo comprehensive checkups at least once or twice a year at reputable medical centers. Essential tests include blood pressure, blood glucose, lipid profile, liver and kidney function, ECG, echocardiogram, and vascular ultrasound. For those with existing illnesses, screening should be more frequent based on specialist recommendations. Additionally, anyone who experiences transient ischemic attacks, such as temporary numbness, slurred speech, or dizziness that resolves within minutes, should seek immediate medical evaluation, as these may precede a true stroke. Regular checkups not only control disease but also provide peace of mind. Early detection reduces treatment costs, and improves recovery chances. Proactive health monitoring is wise investment to prevent stroke and protect joyful, healthy life in old age. 8. Recognize early signs of stroke. One of the most critical factors in stroke survival and recovery is timely recognition and response. The earlier emergency care is initiated, the higher the chance of recovery and the less brain damage incurred. Therefore, recognizing early stroke signs is a life-saving skill for both seniors and their caregivers. Stroke symptoms occur suddenly and are often easily identified using the FAST acronym, a simple and effective memory aid. Buff face, facial droop on one side, uneven smile. Arms weakness or numbness in one arm, unable to raise both arms equally. Speech slurred, garbled, unclear speech or inability to understand speech. Time if any of these signs appear, call emergency services immediately. Dial 911 in the U.S. Other warning signs may include sudden dizziness, loss of balance, severe unexplained headache, or temporary vision loss in one eye. Never attempt self-medication, home remedies, or wait and see, as this can waste the golden window for treatment. Keep the person still, turn their head to one side if they vomit, and call emergency help right away. Equipped with early recognition knowledge and proper response, families can safeguard the precious lives and health of older loved ones in emergencies. In summary, stroke is a serious threat to the health and life of older adults, but it is largely preventable with proactive care. Effectively controlling blood pressure, managing chronic diseases, maintaining a healthy diet, regular exercise, avoiding tobacco and alcohol, reducing stress, getting enough sleep, and having routine health screenings are practical, effective strategies. Moreover, recognizing early warning signs and responding properly can save lives in the critical moments. Every older adult with family support should enhance their awareness and prevention efforts to live healthy, joyful, and quality lives in their later years.